And so in British Columbia, we have a primary care sector that has developed over time. And the model I always describe is it's like if we run our school system the way we run our primary care system, it would be as though teachers set up shop and then students kind of come and knock on their door and say, could I come into your class? And the analogy I make for the PCN is that it's like a school district model where we start thinking about the population as a whole. We want to provide education to all students, not just the ones that can find a teacher. We want to provide primary care to all British Columbians, not just the ones that grew up in a certain community or had the good fortune to get connected. And on the flip side, I think for physicians, they sometimes feel like they're running their own schools without support.
A lot of our rural and remote communities already operate in a team-based model and already work really collaboratively with their communities, with their allied health professionals. PCN formalizes that and allows us to do that in a way that's funded and more consistent, and hopefully long-term creates a lot more stability in our rural communities for team-based care, which ultimately really supports the physicians to do the work they're best at.
I guess my words of advice for PCN is it's worth it. That, and this is language we've used in Chilliwack for years, which is PCN is not a new work, it's new language for the work we're doing already. And I think that is so said multiple times over in rural. The integrative, interdisciplinary team of people working together has been in rural for years and years and years. We're now just calling it PCN and hopefully having some more resources to it, but the work is still us. And the PCN is not something good entity, it's just us working together with hopefully a little bit more resource and a little bit more prospective doing something different or new. And who better to execute a PCN, magically, but rural communities across BC.
I would encourage the PCNs in our province to hold the vision of their communities and for their communities up whenever they encounter struggle. There is no perfect process, and there will never be enough funding to solve all of our problems. But there is resilience in relationship and there is funding available. So take what you can get and run with it.
In order to have truly healthy rural communities, it's vital that we also have healthy rural physicians.